If you've been told you have an L4-5 disc bulge, you're probably getting a lot of conflicting advice. Some people tell you to walk, others say you should rest, some recommend stretching, while others warn it could make your symptoms worse. Then you're left wondering if you need an MRI, whether you should see a chiropractor or a surgeon, if a back brace will help, or if even inversion therapy is worth trying. After more than 25 years of treating patients with disc injuries, I found that people struggle because of the disc bulge itself. They struggle because no one has ever explained which decisions to make first. In this video, I'm going to walk you through 8 of the most important decisions that could affect your recovery so you can avoid common mistakes and move forward with greater confidence. Be sure to stay until the end because the final decision is often the one patients worry about the most, and understanding it could completely change the way you think about your diagnosis. Whether you've been dealing with symptoms for a few weeks, several months, or even years, you've probably already tried everything. Maybe you've been walking every day. Maybe you've stopped exercising because you were afraid of making things worse. Maybe you've tried stretching, physical therapy, chiropractic care, medications, injections, or several different treatments without getting the lasting relief you were hoping for. The reality is that recovery is rarely determined by one exercise, one treatment, or one appointment. It's usually shaped by a series of decisions you make along the way. Some decisions move you closer to recovery, while others unintentionally keep you stuck or delay your progress. That's why the order of these decisions matter. As we go through this video, you'll start to see how each decision influences the next one. And by the end of this video, you're going to have a much clearer understanding of where you are in your recovery, what decisions you made, what decisions may be helping you move forward, and what changes might be worth discussing with your healthcare provider. Let's start with one of the first decisions almost everyone struggles with. Should you walk or rest with an L4-5 disc bulge? For most people with an L4-5 disc bulge, walking is usually more beneficial than prolonged bed rest because gentle movement helps your spine function the way that it was designed to. That may sound surprising because when your back or your leg hurts, your natural instinct is to often just lie down and avoid movement. While a brief period of rest during a severe flare-up may be appropriate, spending days or weeks in bed often creates problems that can slow your recovery. When you stop moving, the muscles that support your spine begin to weaken, your joints become stiffer, and your overall mobility starts to decline. The longer that cycle continues, the harder it can become to return to normal daily activities. Walking produces the opposite effect. Every step gently activates the muscles that help stabilize your spine, keeps your joints moving, improves circulation to the surrounding tissues, and helps to reduce stiffness that develops with prolonged inactivity. Walking also benefits the intervertebral discs themselves. Unlike many other tissues in your body, spinal discs do not have direct blood supply. They receive oxygen and nutrients through movement. As you walk, the normal loading and unloading of the spine acts like a pump, helping move nutrients into the disc while carrying waste products away. Although walking won't make a disc bulge disappear, it helps to create a healthier environment that supports normal disc function and recovery. That doesn't mean you should force yourself to keep walking no matter what. If your leg pain, numbness, tingling, or weakness consistently becomes worse the longer you walk, or your symptoms remain significantly worse afterwards, your level may need to be adjusted. In many cases, shorter walks with more frequent breaks are better tolerated than trying to complete one long walk. Rather than asking whether you should walk or rest, a better question is whether you're walking at a level your body can tolerate without continually aggravating the injured disc tissue. You've now got a better understanding of how much you should be walking. The next question you may be asking yourself is whether stretching will help your recovery or make your symptoms worse. Should you stretch for an L4-5 disc bulge? Yes, stretching can be beneficial for many people with an L4-5 disc bulge, but only when you're stretching the right tissues at the right stage of recovery. If you've searched YouTube videos for disc bulge exercises, you've probably seen hamstring stretches, piriformis stretches, knee to chest stretches, lower back stretches, and nerve gliding exercises. Some of these can be very helpful, but none of them should be treated as a one-size-fits-all solution. In general, stretching is appropriate when your muscles have become tight from guarding, reduced activity, or altered movement patterns. As your pain settles down, gentle stretching may improve flexibility, restore normal movement, and reduce stiffness that develops around the hips, pelvis, and the lower back. Hamstring stretches may be helpful if tight hamstrings are limiting your mobility. Gentle piriformis stretches may reduce tension around the hip, and in some people, knee to chest stretches may also provide relief for individuals whose symptoms improve with spinal flexion, particularly if standing or walking tends to aggravate their discomfort. There are also times when stretching is not the right decision. If stretching consistently causes your leg pain to travel farther down the leg, increases numbness or tingling, or leaves your symptoms noticeably worse afterwards, stop doing the stretch. Those changes may indicate that you're placing additional stress on an already irritated nerve or disc rather than helping it to recover. The same applies if you've been repeatedly stretching for weeks or months without lasting improvement. At that point, the problem may not be a lack of flexibility. It may be that stretching isn't addressing the underlying cause of your symptoms. Stretching should leave you moving better, not feeling worse. Your body's response over the next several hours or even the following day will usually tell you whether you're moving in the right direction. You've now got a better understanding of when stretching may help and when it can actually make your symptoms worse. The next question you may be asking yourself is whether you need another MRI or if the one you already have tells you everything you need to know. Do you need an MRI for an L4-5 disc bulge? You may be surprised to hear that for many people, the answer is no. Now, why is that? Because most people with an L4-5 disc bulge can be diagnosed from your medical history and a thorough physical examination. And an MRI isn't always necessary to begin conservative treatment. An MRI is an excellent imaging test because it allows us to see the spinal discs, the nerves, the ligaments, and other structures in great detail. However, it's important to remember that the goal isn't simply to find a disc bulge. The goal is to determine whether the MRI findings actually explain your symptoms and whether the results will change your treatment plan. Research has shown many people who have no back pain at all have disc bulges on MRI. At the same time, people with significant pain may have relatively small disc bulges. That's because your symptoms depend on much more than just the image itself. Inflammation, nerve irritation, joint dysfunction, muscle function, movement patterns, and your physical examination all help us to determine and understand what's actually causing your pain. An MRI is usually recommended when your symptoms suggest a more serious problem, such as progressive muscle weakness, significant changes in bowel or bladder function, severe trauma, signs of infection, or if your symptoms haven't improved after an appropriate course of conservative treatments and the results would change your treatment plan. For many people with a typical L4-5 disc bulge, it's reasonable to begin with conservative care without an MRI first, provided there are no warning signs and you've been properly evaluated by a qualified healthcare professional. You've now got a better understanding of when an MRI may or may not be necessary. The next question you may be asking yourself is, which healthcare professional is the right one that fits your recovery? Should you see a chiropractor or a physical therapist for an L4-5 disc bulge? Both chiropractors and physical therapists regularly treat people with L4-5 disc bulges, but they often approach the problem from a different perspective. Understanding those differences can help you decide which type of care may be the most appropriate for your condition. A physical therapist typically focuses on restoring movement through rehabilitation. Treatment often includes strengthening weak muscles, improving flexibility, restoring mobility, retraining movement patterns, improving balance, and gradually progressing your activities so you can return to work, sports, and everyday life with greater confidence. A chiropractor also incorporates rehabilitative exercises, but the evaluation often begins by asking different questions. Why isn't your spine moving and functioning the way that it should? A comprehensive chiropractic examination may assess spinal joint movement, nerve function, muscle strength, reflexes, posture, movement patterns, pelvic alignment, and X-ray analysis to determine which structures are contributing to your symptoms. If appropriate, treatments may include spinal manipulation or joint mobilization to improve spinal motion, soft tissue therapy to reduce muscle tension, nerve mobilization, postural, corrective, rehabilitative exercises, and activity modifications that help to reduce stress on the injured disc while your body heals. Think of it this way. If pain, joint restriction, or poor spinal mechanics are preventing you from moving normally, chiropractic spinal adjustments may help to restore the movement so rehabilitation becomes easier and more effective. For many people, these approaches aren't competing with each other. They can complement each other. Improving spinal function while restoring strength, stability, and movement often provides a more complete recovery plan than relying on only one approach. No matter which provider you choose, they should perform a thorough examination, explain why they're recommending a particular treatment, monitor how you are responding, and modify your care as your condition changes. Even with the right healthcare provider, many people still wonder whether additional treatments at home can speed the recovery or provide extra relief. The next question you may ask yourself is whether an inversion therapy is worth trying. Can inversion therapy help an L4-5 disc bulge? Yes. For some people, an inversion table may provide temporary relief. Inversion therapy is a form of traction that uses gravity to gently stretch the spine, which may temporarily reduce pressure on the discs, joints, and irritated nerves. However, it is important to understand that inversion therapy is different from non-surgical spinal decompression. An inversion table relies entirely on your body and gravity, so the amount of traction can't be precisely controlled or adjusted throughout the treatment. Non-surgical spinal decompression is performed on a computerized treatment table that allows your healthcare provider to precisely control the amount of pulling force, the angle of treatment, and the cycles of distraction and relaxation. This controlled approach is designed to target specific spinal levels, such as the L4-5, while helping the surrounding muscle tissues stay more relaxed during treatment. Neither treatment is a cure for a disc bulge, but both may help to reduce pressure on irritated spinal structures in appropriately selected patients. If you have uncontrolled high blood pressure, glaucoma, certain heart conditions, or other medical concerns, speak with your healthcare provider before using an inversion table because it may not be appropriate for everyone. Can non-surgical spinal decompression help an L4-5 disc bulge? Yes. Non-surgical spinal decompression may help some people with an L4-5 disc bulge, particularly when the disc is irritating or compressing on a nearby nerve. Unlike an inversion table that uses gravity to stretch your spine, non-surgical spinal decompression is performed on a computerized treatment table that allows your healthcare provider to precisely control the amount of traction, the angle of pull, and the treatment cycles. This allows the treatment to target a specific spinal level, such as the L4-5, while minimizing muscle guarding that can occur with less controlled forms of traction. The goal is to gently reduce pressure within the affected spinal segment, which may help relieve pressure on an irritated nerve. The goal is also to improve the movement of fluid and nutrients into the disc and create an environment that supports the body's natural healing process. That doesn't mean that spinal decompression is appropriate for everyone. People with certain spinal fractures, severe spinal instability, some advanced spinal conditions, infections, tumors, or other medical concerns may not be good candidates. That's why a thorough history, physical examination, and review of your imaging are important before beginning any treatment. For the right patient, non-surgical spinal decompression can be an effective part of a comprehensive treatment plan, especially when it's combined with rehabilitation, exercises, activity modifications, and other conservative therapies rather than just being used as a standalone treatment. Should you wear a back brace for an L4-5 disc bulge? Yes, a back brace can be very helpful for people with an L4-5 disc bulge, but it should be used as a temporary tool rather than a long-term solution. A back brace may provide additional support during a painful flare-up or while performing activities that place extra stress on your lower back, such as lifting, prolonged standing, or long car rides. For some people, that added support can help to reduce pain and make daily activities more comfortable. However, wearing a back brace all day, every day, isn't usually recommended. Your spine depends on your muscles in your abdomen, back, hips, and pelvis to provide natural support. If you rely on a back brace instead of rebuilding those muscles, it may delay your progress towards long-term recovery. Think of a back brace the same way you would a knee brace, an ankle brace. It can provide support when you need it the most, but it shouldn't replace strengthening, rehabilitation, and restoring normal movement. Used appropriately, a back brace can be a helpful part of your recovery plan. Relying on it as your primary treatment isn't usually the best long-term strategy. The final question, and often the one people worry about the most, is about spinal surgery. When should you consider surgery for an L4-5 disc bulge? The good news is that most people with an L4-5 disc bulge improve without surgery. Conservative treatments such as activity modifications, rehabilitation, chiropractic care, physical therapy, medications, spinal decompression, and time often provide significant relief. However, there are situations where surgery becomes an important consideration. One of the clearest reasons is progressive muscle weakness. If you notice your foot becoming weaker, you're having increasing difficulty lifting your foot, standing on your toes, or your leg is becoming progressively weaker, you should be evaluated promptly because ongoing nerve compression can lead to permanent nerve damage if left untreated. Surgery may also be necessary if you develop severe numbness around the groin or saddle region, or if you lose control of your bladder or bowels. Now, these symptoms may indicate a rare but serious condition called cauda equina syndrome. Now, that requires immediate emergency medical attention. For other people, surgery becomes a reasonable option when leg pain, numbness, or weakness continues to significantly interfere with everyday life, despite completing an appropriate course of conservative treatment. If your symptoms haven't improved over several months of well-managed care and your physical examination MRI finding clearly match your symptoms, discussing surgical options with a spine surgeon may be appropriate. The important thing to remember is that having an L4-5 disc bulge on an MRI does not automatically mean you need surgery. The decision is based on the whole picture, including your symptoms, physical exam, imaging findings, response to conservative care, and how your condition is affecting your quality of life. For many people, surgery is never necessary. For others, it can be the right decision at the right time. The key is making that decision based on a thorough evaluation rather than fear, frustration, or the MRI report alone. Today, we covered the 8 most important decisions that could affect your recovery from an L4-5 disc bulge. We discussed when to walk or rest, when stretching may help or hurt, whether you really need another MRI, how to choose between chiropractic care and physical therapy, when an inversion therapy and non-surgical decompression may be more appropriate, whether a back brace is worth using, and when surgery should be considered. My hope is that you now have a clearer understanding of your treatment options and feel more confident about making informed decisions throughout your recovery. Which part of today's video helped you the most? Was it understanding when non-surgical spinal decompression may help or when surgery should actually be considered? Drop a comment below, let me know. If you found value in this video, please give it a like and share it with someone dealing with an L4-5 or an L5-S1 disc bulge. Doing that helps more people find practical, non-surgical solutions that may help them reduce their pain, move better, and get back to living their normal life. And if you want safe, non-surgical, science-based solutions to relieve your pain, protect your spine, and restore your mobility so that you can start living your life again, be sure to subscribe to my channel. Now, if you'd like to learn whether non-surgical spinal decompression may actually be the right treatment for your L4-5 or an L5-S1 disc bulge, go watch this video next. I'll explain how spinal decompression works, who is most likely to benefit, and how we use it to help our patients reduce nerve irritation, improve function, and avoid surgery whenever possible. Go watch that video next.